What's up, wild ones? Ariana here. Here's some whiskeys for you too. And we're here to talk to you about my experience being an internal medicine veterinary technician in a specialty in emergency hospital. Whiskey's just going to be here for emotional support, I guess. Yeah. And I've got some exciting news. So it is Vet Tech Week. I've got some cool things happening. One, if you check out my website, I am doing pet portraits and doing pet portrait stickers. So they're so cute. It's like, this is my circus, these are my monkeys, these are my monkeys. I do pet portraits like this, and I love doing it. And I'm going to have a sale for the third week in October for vet techs and veterinary staff. And remember, 10% of all of the proceeds gets donated to Save the Wild Ones Fund, which aims to help wildlife rescues, shelters, those kinds of places that need that funding and don't necessarily get it. So I have a little notebook here. We gotta find a page because we're not prepared. If you hadn't seen my other video, go check it out. It was my year or so in the ER working as an ICU ER triage tech. I left that job to become an internal medicine technician. If you don't know what internal medicine is, it's pretty much the catch-all of everything. So, if it's not cancer, we don't know if it's cancer yet, or if they've been having vomiting and diarrhea for months and the primary veterinarian can't figure it out. They recommend you to us. There's so many other diseases and disease processes that you work with, so it can be very overwhelming, as it was for me, right? Mommy was sad. But we'll get into all of that. I started at this new emergency and specialty. I started out 2 months in the ER because I was waiting for my doctor to come back. 2 months in the ER, this is not the same ER as the one that I was used to. Yeah, there's times it by 3, and that's the amount of patients that they see, both in their ICU. They have a completely separate ICU, completely separate ER, and these people are unreal about the amount of knowledge that everybody has and the way everybody works, and it's overwhelming, to say the least. I've now learned I am not an ER technician. We'll not be doing that again, unless it's a slow ER, right? Mommy was there. Started out there, at least got a feel for the hospital, which in the grand scheme of things, pretty happy that it happened that way, just because of the fact that when you pick up shifts, or most practices require you to be on call for the ER, even if you're in specialty. So you're at least on call. It depends on where you work as far as how often you're on call. For us, it was every 8 to 10 weeks, but the last practice I worked at, I think it was once a month. Sorry if this is distracting. You're not helping. You're a cute co-star. Anyway, that's one thing you have to know about being in specialty, is you're probably still going to have to work in the ER and be on call. How much your practice uses on call is really just going to kind of depend on your practice. So that's something to think about when you're asking questions in your interview, is how does on call work? How often do you get called in? Stuff like that. We deal with everything internal. And so essentially what internal medicine technicians do is we maintain the patients, we talk to our clients, we hold hands. If you don't know anything else about going into internal medicine, we have very, I don't want to say high maintenance, but it's kind of high maintenance. And it's in a good way, in the sense that these people care about their pets, and they are willing to put whatever money that they have to fix their pet. But you also have the opposite side of the spectrum, where the primary veterinarian recommended that they see an internal medicine specialist because they're throwing their hands up, they don't know what to do anymore. And these people, the other side of the spectrum, aren't really necessarily aware about how much it costs and just everything that's involved. It's not a quick fix. It's maintaining care, usually for the life of the pet until they go down the hall to oncology. I came into internal medicine already not very confident. And a lot of that has to do with epilepsy, my memory, a couple other factors. It just makes the job harder than what I remember it to be. Going into the ER for 2 months, being way overwhelmed, and then going into internal medicine was just like, oh, okay, maybe I can breathe. First few weeks, very overwhelming, because these diseases that we work with, there's a reason why the primary veterinarians aren't really versed in them very well, because it's definitely not words or terms you see in general practice. So that's something that was overwhelming. So now I have to learn all of these diseases to be able to better educate the clients, give them the education necessary to want to treat their pet, rather than just be like, well, I don't understand why this is necessary. That education, that knowledge of the disease processes and why tests are important, why drugs are important, why diets are important. There's so many things you have to know, and internal medicine technicians and doctors are probably the smartest people ever. Everybody in that building and specialty and emergency is smart, but the amount of knowledge and catch-all that internal medicine is, it's overwhelming. If you don't have a good memory, it will be difficult. And I would say if you are planning on trying to apply, definitely do your research. Not even research, study. I can leave a list or do something, I'll figure something out. I want to do something to help in that sense. Maybe a video, who knows, anything can happen. But that's a thought, and it is on the way. I just don't know when. I was really overwhelmed. So essentially, because pharmacology is not my strong suit, never has been, never will be, traumatized from pharmacology class is a good way to put it. So that was difficult. So I had a Google Doc of drugs. I had a Google Doc of disease processes and other things, and then for my patients, because that is something else that was difficult. Remembering all of your patients. There's so many of them, because we would have like 6 appointments for our current patients and then 3 appointments for new consults a day. So you're adding those on daily. Because I was having difficulty remembering things, if there was something that I didn't remember or something I wasn't familiar with or something that I needed to know more of, I would type it on my list, and then when I'd have free time throughout the day, I would look these things up. I would look at plums and get all the drug information that would be important to know and all those things. And I would do that for the disease processes and clinical signs and all these things, so I could keep track of it and have something to study at home. I think that helped a lot, because I would keep it up on my computer too, and then be able to pull it up real quick if I wasn't sure. So if I was on the phone and then someone asked me a question, I'd be like, hold on one second, let me look into that for you real quick. And then I'm just looking at my sheet of paper and cheating. It worked. In the same respect, it kind of depends on your doctor too, because although that system worked for me and I felt like it was helping out, and where, because I didn't know a whole lot, and because I was so far behind for reasons A, B, and C, it made my doctor nervous. We got along great. I love her. She's a cool person. But there's also that professional level that you also got to think about, because although you can get along as people, the professional level may not mix so well. And that's just no fun for anybody involved. And so it makes the whole environment stressed. I was stressed, so I wasn't holding on to anything. You know, the doctor was stressed because not only did she have to deal with her patients, but she also has to deal with a technician that's pretty behind, and she's used to having technicians that are on top of it. So now she's stressed, I'm stressed, everybody's stressed, which leads to, yeah, I kind of got fired, sort of. Not really. It worked out great, because I think it was just a situation where, you know what, this isn't working. She's good tech, but this just isn't a good fit. And then so they created a new position for me as kind of like a discharge technician. And so I did a whole bunch of other stuff that way. And, you know, we switched around and it worked out. You know, at the end of the day, oh, did it hurt my feelings? Was I upset? Absolutely. We're all human. But what I've learned from it is in vet med, it matters the team. And it matters that everybody cohesively works together. And if it doesn't, it may not be any hard feelings. It's just a matter of You need to be on top of everything, because if not, that's when accidents happen. At the end of the day, there's no reason to make yourself upset. And I didn't know the behind the scenes and the conversations that were had. And so why irritate myself and get upset and offended when, it could have been a good conversation. It could have just been, it's not working. I like her, but we're not a good fit. If that ever happens to you, try your damnedest to not get upset and not get offended, because you've got a small team. It's not like general practice where you could have a couple doctors and quite a few technicians for each doctor, and then, people to like blend the pot a little bit. When you have a doctor, 2 technicians, and an assistant, you're really close quarters. And there's really not too many other people to rely on. So there's so many factors that go into it. So just don't get offended. Don't get upset. And if you do, talk yourself out of it. As far as pay goes, this has changed a little bit with COVID. The position that I applied for, I think, was anywhere between 22 and 24. 24s, you got a lot of experience. 22s, I'm assuming baby tech. The range for internal medicine technicians, it kind of varies. I've seen anywhere from 20, 21 to 25, 26, but that's COVID. That wasn't like that before. And I think the 24 to 26 range is not going to be common. And I think a lot of that is going to be how much experience you have. I have 10 years of experience in the animal field, but I have it all over the place, and mostly exotics and zoo and aquarium, not internal medicine. What would your week tickly? What would your week typically look like? Essentially, we had it where we worked 4 days. 3 of those days were appointments, so those could look like anything. We could get out at 3, we could get out at 7, depending on the appointments for the day. And then a lot of times, the days that we had appointments, we would also sometimes take on hospitalized cases. So if you just work in a specialty with no ER, I don't think that would be a thing, but I think most specialties and ERs are together. So that's a possibility. And there's like 4 internal medicine teams, and they would go between them to kind of divvy up the hospitalized patients that they would take over. There would be other times where through the ER, if a patient needed an ultrasound, they would do it through the ER, but the ER doctor would be the one overseeing everything and communicating with the client, and then we would just be doing the ultrasound. Those are other things that you could do. Then we had procedure day. And typically the procedures that we do are CT scans. We would do endoscopes, either uppers or lowers. So see, are they, do you see any disease processes going on? Is there anything that doesn't look normal? A lot of getting samples. We would also do rhinoscopies, so you check all the nose, what's going up here. So there's a couple different procedures that you do. I do think that depending on the internal medicine doctor, it'll also depend on the procedures that they do or that they're comfortable doing. But those were the general ones that not only did I see at the first place that I was at, but when I worked in the ER, the internal medicine department did that too. So a couple different things you could do. I will forewarn you, just like in the ER, people in emergency and specialty, the technicians, the doctors, these people are so smart, but it is such a stressful environment. So, you got people that are focused all the time, get the job done, get, these patients in and out, make sure everything's done appropriately. That comes across kind of crappy if you don't take a step back and think, okay, they're not being nasty to me. They're one-track mind. Things got to get done. Things are dying. Things are sick. They need to be taken care of. Your feelings kind of got to get pushed to the side. Direct and to the point. That is, I know it's happening and it's hard. And there are a couple times where I got really offended, but then I took a step back and I'm like, okay, that could have not had anything to do with you. So take a step back, and until you know for sure it has something to do with you, just let it be. Let them be them. Let them, because that's the way that they get that out, that they can get the job done. So know going into it, very, very strong personalities. Sometimes good, sometimes bad. And you're going to have a whole bunch of different personalities when it comes to that. But those are going to be your typical ones. The really stern, I've got a job to do. The ones that are like kind of in between. And then you've got the really super sweet, quiet, and if nothing else, just overall, humble people. But those are usually the people that have had nasty experiences in the past, and then they want to be different technicians, and they just want to try and bring as much light as they can. Doesn't say that there's anything bad with the technicians over here that are really stern, because they're just as important and the job needs to get done too. These people help these people help these. It just works. It's the whole conglomeration of really smart people. I did not feel that smart. So that is why I decided to go back to GP. It's super exciting because it's going to be with exotics and small animals. So I'm super excited. I went to vet tech school to be a marine mammal veterinary technician. I don't live anywhere by marine mammals. I did an internship at the Clearwater Marine Aquarium, and then life happened and I'm back in Michigan. So this is the closest I can get to exotic animals, because you work at a zoo, and we'll just get into that another time. So if learning about zoos and aquariums and what it takes to work at those, if that's something that you're interested in, like this video. If you're interested in buying my animal stickers or a pet portrait, check out my website. Link's going to be down below. If not, that's fine too. Just stay wild and I'll be happy. Bye guys.